session, clinical nurse consultant Vicky Evans demonstrates how to conduct a neurological assessment. A neurological assessment requires a systematic approach. It includes an assessment of level of consciousness, cranial nerves, mental status including memory, language and communication, motor function and sensation. As you saw in the patient assessment at a glance, you begin by conducting a primary survey: airway, breathing and circulation.
Firstly, what brings you here today?
Next, you take the patient's history, but with a particular focus on their neurological status. Ask them about their chief complaint, history of the present illness, relevant past medical history, medications, whether they are left or right-handed, and if they are experiencing any other symptoms.
There's a headache and I thought I'd get a check out.
To assess their level of consciousness, you use the Glasgow Coma Scale.
Joe, the Glasgow Coma Scale was invented in 1974 in Glasgow, and it's a way to standardise the neuro assessment so that one country knows what the other country is talking about. It's a score of 3 to 15, 3 being a pretty bad score, so the higher the score, the better.
There are 3 components to the Glasgow Coma Scale: eye-opening, verbal and motor response. As Christian's eyes open spontaneously, he gets a 4 for eyes opening. Next is verbal response.
Can you tell me where you are today?
In hospital.
In hospital. Which hospital?
As he is orientated to person, place and time, he gets a score of 5. Next in the Glasgow Coma Scale is the motor response.
Can you give my hands a squeeze? Squeeze my fingers as hard as you can. Good. And Joe, we do both of them together so that we get, there's a control. Okay, what we have to do now is get Christian to actually let go. Okay, so Christian, can you let go there, please? That's great, because it could be a reflex action. So we want the patient to let go, so he's in control of that sort of thing. Christian, now I'd just like to pull down the sheet, if I may. And what we'd like to do is have a look at your feet. Okay. Christian, can you push down against my hands? Push down, okay.
That's great. And push back against my hands.
Okay, good. And
so they're both equally as strong.
equal, okay.
Christian obeyed commands, so he gets a score of 6, giving him a score of 15 on the Glasgow Coma Scale.
Or one side of his...
If a patient does not respond spontaneously or does not respond to verbal stimuli, then you need to use painful stimuli.
What we normally do is trapezius squeeze. So we actually get up here. Christian, I won't hurt you, but we actually squeeze into here, give it a good squeeze, and Christian will sort of do this sort of thing. The other way we can do it is a sternal rub. So we can rub in here fairly hard, and that what we'd like to do is for Christian to actually move that noxious stimuli away.
When you have completed assessing the patient using the Glasgow Coma Scale, document your findings and compare to previous results. Report any changes to a senior member of staff.
So Christian, what we need to do now is your vital signs, okay? So your temperature, blood pressure, pulse, that sort of thing. So
taking a patient's vital signs is essential to establish a baseline and to monitor the patient's hemodynamic response to a raised intracranial pressure. A patient with raised intracranial pressure may exhibit hypertension, a widened pulse pressure, bradycardia, and abnormal respiratory patterns. When you have taken a patient's vital signs, document your findings and compare to the previous results. Again, report any changes to a senior member of staff. Next, you assess the cranial nerves. There are 12 cranial nerves that are assessed either separately or in a group. This gives you important information about brain function.
excellent.
The first cranial nerve is the olfactory nerve, responsible for the sense of smell.
So, Christian, I'd like to get you to close your eyes for me, and I'm going to put something under your nose, and I want you to tell me, have a sniff, and tell me what you think it might be. Can you smell anything there? What's that?
Coffee.
Coffee, okay, excellent. So, Christian's sense of smell is doing quite well.
The second cranial nerve is the optic nerve, responsible for vision. To test this nerve, first ask the patient to read something.
Christian, can you tell me what that says?
Thinking of you.
Next, you test the patient's visual fields and accommodation.
Christian, can I get you to get your right hand and cover your right eye? Okay, and look at me. over this way. You might need to move that. That's it. Look at my nose, okay? And I want you to tell me when you can see my fingers wiggling.
I can see them coming.
Okay.
Yep.
Okay. And.
Yep.
Okay.
Yep. I can.
Okay, good. And swap hands. Top of the other eye. And again, when can you see my? Okay.
Yep.
Okay. Great. Okay, that's excellent. Can you follow my finger as well? Okay, and follow it inwards. Okay, and back out again. That's great. Okay, so Christian is accommodating to my finger there as well. He can see in all sort of quadrants, so his visual fields are intact.
Next, you assess the pupils. Check both pupils for a direct and consensual response. The third, fourth and sixth cranial nerves are responsible for the extraocular movements.
Together, and we're going to test extraocular movements. So there's 3 nerves that do that. So it's the third cranial nerve, the fourth and the sixth. Or the oculomotor, the trochlear and the abducens. Okay, so what we're going to do is to say to Christian, look at my finger and just with your eyes follow it up and follow it down and over to the right and over to the left. Excellent. And sometimes we like to pause on the lateral gazes because you're looking for any sort of nystagmus, any sort of flickering of the eye, okay, which could be a sign that there's a neurological problem, but it also could be a sign of too much dilantin, okay, so dilantin toxicity. Okay, so Christian did really well there. That's good. So we also want to look at, does he have a ptosis? And do you know what a ptosis is?
No.
Ptosis is a droopy eyelid. Okay.
Oh, right.
So have a look at Christian's eyes, just sitting there like that. Does he have a does he have a droopy eyelid?
No,
No, they're pretty good. Okay.
The fifth cranial nerve is responsible for sensation to the face. The seventh for facial movement.
So to test the fifth cranial nerve, we're going to look at Christian. A lot of neurosurgery or neuroscience is done with observation, so these things are important for you. Okay, so what we want to do, Christian, I'm going to touch your face, okay? And I want you to tell me, does it feel the same on either side? Yeah, and down here, so this is V2, and down here, nice and furry. Okay, and that feels the same, okay. Christian, also, the fifth and the seventh nerve act together, so they work in conjunction with each other. So what I want you to do, scrunch your eyes up really, really tight, okay? Don't let me open them. Okay, good. Okay, show me your teeth. Okay, puff your cheeks out. Excellent. And touch your face. Good. Somebody with a facial, let go. Somebody with a facial weakness wouldn't be able to hold the air in there. Okay?
Right.
So if they've had a stroke, okay. And again, not that I'm saying anything against your age, but we like wrinkles in neuro because if the wrinkles aren't there, it means the facial weakness has started. Okay. So we want to look out for those sort of. And again, it's all your powers of observation. We want one side of the face to look like the other side of the face. Okay. We want one side of the body to work like the other side of the body.
To test the corneal reflex, observe the patient for
And
blinking.
we can see that Christian is actually blinking quite well, so he doesn't seem to have a corneal problem. And when I move things towards his face, you can see that he blinks, so that's a protective mechanism.
The eighth cranial nerve is responsible for hearing and balance.
Christian, I'm going to sort of make a bit of noise in both of your ears. I want you to tell me if it's the same, okay? Okay, you can hear that?
They sound the same.
So what you're doing is basically getting a fingernail and just clicking it. Or if you don't have any fingernails, just get the hair that's close to Christian and just rub it together like that. Okay.
The ninth and 10th cranial nerves are responsible for the gag and cough reflex.
To test your 9th and 10th nerve, which you know very well is the glossopharyngeal and the vagus nerve, it does your gag reflex, okay, gag and swallow. So what we want to do here is, well, first of all, we're observing again that Christian is not drooling out the side of his mouth, so he's maintaining his own saliva. That's a big giveaway if they are. And what we want to do is to make sure that everything's working and intact. So we'll get Christian to, can you open your mouth for me? Stick out your tongue, okay, and say ah. That's great. Excellent. Did you see how his soft palate went up? So we're looking at the uvula, on either side of the uvula. When the patient says ah, it's going to go up.
The 11th cranial nerve is responsible for shoulder shrugging and head turning.
The 11th nerve is actually looking at the sternocleidomastoid muscle, which is the big muscle down here, and we're looking at the trapezius muscle as well. Now, the trapezius, you might remember, is the muscle that we're going to squeeze to get
the
painful stimuli. So what we're going to do is, if we wanted to do that, we would squeeze tightly here, so like that. Okay. But we don't need to do that with Christian because he's okay. But what I'm going to do is test his muscle. So can you shrug your shoulders for me, Christian? Excellent, good. And we do together because you want to control. You don't do one and then the other, we do them together. Okay, so he's got good movement there. Can you push against my hand, Christian, with your face? That's it. And this one? Okay, great. So it's nice and strong there.
The 12th cranial nerve is responsible for tongue movement.
Okay, so if you stick out your tongue and move it from right to left, excellent. And again, that's fantastic. Christian can move it from right to left. We're also looking at, again, symmetry. So the middle down the tongue, there's a bit of a line, so one side of the tongue has to look like the other side of the tongue.
Okay.
Okay, you're looking for any fasciculations. You're looking for one side that might be smooth, the other might not be smooth, so that sort of thing. If the patient sticks their tongue out and it deviates to the left, the problem is on the left-hand side. Okay, so we're looking at that, but Christian's is really good. And the
systematic assessment of the 12 cranial nerves will provide you with valuable information about brain function. After the cranial nerve assessment, you assess the patient's mental status, including orientation to person, place and time, memory, calculation, abstract thinking and judgment, constructional ability, and speech and language.
What we'll use is our PTA form. Okay.
As Vicky has already assessed Christian's orientation during the Glasgow Coma Scale assessment, she moves on to memory. To assess memory, Vicky uses the following questions from the post-traumatic amnesia tool.
Okay. And what
How old are you? What is your date of birth? What month are we in? What time of day is it? What day of the week is it? What year are we in? What is the name of this place?
Okay, and Christian got a score of 7 out of 7. You'd need to check that with his addressograph label to make sure that he's getting okay. And then what we're going to do is show him some pictures.
Next, the patient is shown 4 pictures.
We can do that.
Test the patient's recall of these pictures within a few minutes and again in 1 hour. This assesses both short and long-term memory and is important in testing for post-traumatic amnesia.
So there's a number of sets that we can use. They're all different. Different ones. The face remains the same. Okay. So Christian, can you see this? What's this a picture of?
A lady called Jane.
A lady called Jane. Okay. What's this?
A coffee cup, set of keys, and scissors.
Okay. So we want to get him to remember it's Jane, cup, keys and scissors.
Yep.
So what we'll do is we'll ask him to remember those sort of things. And Christian, can you tell me what happened to bring you here again?
I was having a game of football with me mates, and after the match I felt a bit of a headache, a bit of soreness in my head. So I thought I'd come here and get it checked out.
Okay, and you didn't lose consciousness?
No.
So what we want to do is test that what he can remember up to, because usually if it's bad head injury, they can't remember things. Okay, so if they can remember what they were doing up until the point of the accident, and then they usually remember that they've arrived at hospital. They don't remember that other period. What were those pictures I just showed you?
A lady called Jane, a coffee cup, scissors and a set of keys.
Okay, so good. So you want to just test that he can remember it, okay? That's great.
Assess the patient every hour for 4 hours.
Okay. Right. And he needs to get 3 lots of 12 out of 12 before we can actually let him go home.
Next, assess the patient's attention and focus using serial 7s and spelling backwards.
What do you like at maths?
Okay.
Okay, I'm going to do what's called serial 7s. So I'm going to ask Christian, we're starting at 100, and I want you to subtract 7 from 100 and then 7 from that number until I tell you to stop. Do you think you can do that?
I'll try.
Okay, so 100
minus 7 would be 93.
Minus 7
would be 80. So 88. No, minus 7, 3 and 4, 86.
Good. Minus 7?
79.
Good, okay. Now if Christian couldn't do that, or just said, no, I can't possibly do that, like I would say, we would ask him to spell the word world backwards.
Right.
So let's have a go at that. Can you spell the word world backwards?
Backwards. D, L, R, O, W.
Then assess the patient's abstract thinking and judgment. Ask the patient to interpret a well-known proverb.
Thinking. So what do you understand by the term, a rolling stone gathers no moss?
But be careful when choosing a proverb. Choose one that you think the patient will understand. What you are looking for is an abstract understanding rather than a literal one.
Things don't get stuck to us.
The original meaning of the rolling stone metaphor has changed over time. It's actually quite difficult to interpret.
Yes.
In this case, you could try another proverb or ask the patient to identify the similarities between two different objects. A cat and a dog, for example, or a rose and a daisy. Then assess the patient's judgment. To assess judgment, ask questions that evaluate the patient's insight and ability to make reasonable decisions.
What brings you here today?
I've a bit of a headache.
Headache?
Yeah.
How did you get that?
Playing a game of football.
Right, okay.
After the game, I just felt a bit woozy. Thought I'd get it checked out.
Good, okay. Any other symptoms?
No, not really. That's really it, just a sore head.
Okay. And did you lose consciousness, do you know, at the time?
No, not at all. It's just after the match.
Right.
I just felt a bit of a headache and I thought I'd get it checked out.
Okay.
Then assess the patient's constructional ability.
Okay, so I'm going to get you to copy this drawing. That's excellent. Okay, so Christian could copy the clock together. So that's great. So Christian, you seem to be functioning all right there.
Then assess the patient's language and communication.
As well. So Christian, are you married or do you...
Single.
Single? Do you live with anybody?
By interacting with the patient, you will be able to assess the patient's comprehension, expression of speech and fluency. To test repetition, ask the patient to repeat a simple word or phrase.
I want you to repeat after me. Today is Wednesday.
Today is Wednesday.
Okay, now this is going to sound strange, but I want you to repeat no ifs, ands or buts.
No ifs, ands or buts.
Okay, now Joe,
Also take note of any speech difficulties, such as slurring, the use of invented words, abnormal word repetition and confabulation. Motor assessment includes assessing muscle size, tone and strength.
question is, can you squeeze my hands hard as you can? Excellent. Okay, good. Let go. Great. I'm going to just borrow this hand for a minute. Can you pull me towards you? Okay, so Joe, we're looking at his muscle here. And can you push me away? Okay, so good. So we've got some good muscle tone here and under here as well. And we're going to do it for this arm as well. Pull me towards you. Okay, and push away. Great. And what we want to do is to make sure he might have good muscle tone here, but he might not be able to lift his arms off the bed. So a lot of times you see that they can do this, but they really can't do that. So Christian, can I get you to put your hands out in front of you, palms facing upwards? We always do palms up because this is really easy, this is harder. Okay, I want you to close your eyes and keep your arms up there. And Joe, we're looking for any sort of pronated drift. So if there's any sort of this sort of thing happening or that sort of thing happening, okay? That's great, Christian, you've done really well. You can open your eyes now. With his eyes closed, he can't see that this sort of thing's happening.
Yep,
With
so
it open,
correct it.
Oh, got to correct that sort of thing. Okay, so that's really good. And we're going to go through all his motor groups as well. So
Assess the muscle groups in the legs.
okay, so again, Christian, push down. Great. And push up. Excellent. Can you lift this leg off the bed? Great. Okay, pop it back down. And this one? Okay, good. Pop that back down for me. Can you lift it up now? Okay, good. What about this one? Okay, excellent. That's great. So we're looking at those muscle groups as well. Okay.
Then assess cerebellar function.
What I want you to do, Christian, is can you do this for me? Faster. That's good. So rapid alternating movements. We're looking at the cerebellum section as well. Okay, that's great. And with your right index finger, can you touch your nose and then my finger? Okay. Keep going. Can you do it faster? Okay, great. So he has to be able to understand and comprehend what I'm asking him to do and differentiate right and left and then do a number of commands. So he's doing that quite well as well. Christian, I'm now going to get you to hop out of bed for me. Maybe we'll get you out this side. And if you can stand up for me. That's great. Feet together. And I want you
Test the patient's balance by asking them to stand erect. Firstly with their eyes open, then with their eyes closed. This is known as the Romberg test.
Okay. Christian, pop back onto the bed for me.
Next, test deep tendon reflexes. This includes biceps, triceps, brachioradialis, patella and Achilles.
We normally don't test everybody's reflexes or all the reflexes when they come in, but we'll just have a little go of his reflexes here. Christian, just lay...
Refer to the neurovascular chapter for a detailed demonstration of reflex assessment.
Do you have ticklish feet?
Sometimes.
Okay.
Next, assess the Babinski reflex.
Have you heard of that?
Positive plantar flexion may indicate disease of the corticospinal tracts.
Toes, okay? Okay, Christian, this might be a bit ticklish on your feet, okay? Just relax. Excellent. Good. In a normal person, that's exactly what would happen.
Also note the patient's posture, gait and any involuntary movement. Assess sensation using cotton wool for light touch, ice for temperature sensation and a blunt needle for pain.
Needle. Okay, so what I want to do is just have a look at your, let's pull this up a little bit. That's fine. And what we would do is to actually just test his level of sensation. So not so much with a head injury, but somebody who would come in, they've got some sort of sensory deficit, if they've got a neglect down one side or they're weak down one side. I want to find out what level that is. Christian, does that feel the same?
Yes.
Okay, you can feel there's a little something pricking there, and the same on this side. Okay, so we go all the way up as well. And similarly, we do the same thing down here. Christian, can you feel that? Okay. And does it feel the same on this side?
Certainly does.
Okay, excellent. And if the patient was a spinal cord injured patient or somebody that's had a stroke, you would want to know where that sort of level is, particularly the spinal cord injured, and they've got the dermatome map that we can look at as well. There's one other thing I'm going to do with the blunt needle. I'm going to have a look at your hand. I want you to close your eyes for me, and I'm going to draw something, a number on your hand, okay? I want you to tell me what number is it.
A 7.
A 7, excellent. Okay.
Then test for discriminative sensation.
Is to have a look at the back of your neck here, and I want you to tell me how many points are there. How many points are touching here?
1, I think, or 2.
And close your eyes. And how many points are touching you here?
2.
Okay, so you can see there that I was touching Christian twice on the hand here, but I was also touching him twice up here. And it's because the neurons are further apart up here, you don't have as many as down here, so he can't, it's a 2-point discrimination. Okay, great.
Then test the patient's proprioception.
Okay. What we need to do also is have a look at proprioception, which means where your body parts are in space. Okay, so Christian, I'm going to borrow your finger. Okay, now if this is up and this is down, I want you to tell me where we are, but you've got to close your eyes. Okay, so where are we now?
Up.
Okay, and what about now?
Up.
Good, okay. So you grab the finger from the side, not from up and below, because there's more pressure that way, so from the side. That's great, Christian. And what we do is do it on both sides and on both feet as well. So, Christian, you've done really well.
The neurological assessment is complex. The system demonstrated here will provide you with the foundation upon which you can build your skills.
Everything looks quite good at the moment, so we probably just keep him for observation.
Yeah.